Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey everyone, welcome to the Stay Healthy El Paso podcast. I'm your host, Dr. David Midoff, specialist physical therapist from El Paso Manual Physical Therapy. And today we've got the top 4 reasons for knee pain from walking and running. Now, the reason why we made this set of tips and advice for knee pain from walking and running is because, since all the shutdowns, everyone stayed at home and had to miss going out to the gym, had to miss accessing their treadmills and all the normal workout equipment they might have at the gym if they were going to the gym. And there's been an obvious increase in people out on the streets, out on the sidewalks, running and walking for exercise. And as a result of that, we've seen more patients in the clinic here with knee problems and hip problems and foot problems, but the big one has definitely been knee pain. So I'm going to cover with you today the top 4 reasons for knee pain from walking and running.
Reason number 1, bad form. A lot of people don't realize how terrible their running form or even their walking form is. And every time we get somebody with a knee problem here in the clinic, that's one of the first things we cover. You probably have been walking for years and years of your life. If you've been lucky enough to have functioning legs and everything, you've been walking and probably even running. And you wouldn't think twice about how you did it, the way that you stepped, which muscles you used, how much you raised your knees, how hard you stepped. There's all these different factors that we go into depth on when it comes to walking form and running form. And then it changes at different speeds. So there's likely a huge chance that the way that you're running, the way that you're walking even, is affecting your knee problem. If you take thousands of steps, even just hundreds of steps, it can put some bad forces through tissues that aren't designed to take those forces. Because you've got a running form issue or a walking form issue, it just overloads that tissue. It might be a ligament, a meniscus, could be some cartilage, could be the muscle or tendon as well. If that tissue gets overloaded, then it's easy to just irritate the tissue, eventually possibly tear the tissue, definitely get some swelling in the area. But at the lowest level, your body lets you know by just reporting pain. You just feel some pain in the area. Sometimes the joint, the knee will get hot as well, and sometimes it just gets achy. There are times when the knee won't hurt during running or walking. It actually might feel better, but then later on in the day, the knee starts to ache, maybe even at night. That is a sign that there's some knee problem going on when you're running likely. It typically is a sign that it's a cartilage problem, a ligament problem as well, versus if you get pain during running, it's more likely going to be a tendon or muscle problem. That's not a hard and fast rule. Those are just likely reasons for the problem that you're facing. But if you are having any sort of pain around the times that you're running, whether it's during running, right after, or later on in the day, then there's likely going to be some running form problem or walking form problem. The best thing to do to fix your running form or your walking form is definitely to talk to an expert, especially an expert physical therapist. We deal with movement, with running and walking. There's lots of moving parts that we can address for you. And it's not a big fix most of the time. It's just tiny tweaks that you can make instantly and begin to reduce that pain problem that you're facing in your knee. Reason number 2, too much too soon or overloading. Now, let's assume that you have great running form and great walking form. If all that's fine, it may be that you're doing too much too soon. In other words, you weren't walking as much as you started to walk to recently, and you feel good, you felt fantastic, you enjoyed the fresh air, you enjoyed the sun and everything around you. If you're on a hike, you're enjoying your hike, and you just overdid it, that can definitely cause pain in your knee. So what you have to look at is just dosing it, giving yourself smaller amounts of walking or running, and then gradually building it up over time to the distance or the time that you desire to do that you're going to sustain for the long term. So said differently, if you're going to begin a running program or a walking program for exercise and you want to work up to 3 miles, for instance, you want to be able to cover 3 miles, I wouldn't go into doing 3 miles the first time you go run or walk. That's going to likely overload your tissues and you're going to do too much too soon and you're going to have some knee problem very likely. You got to start out with maybe a half mile to a mile at the beginning, do that for a week or two. It just depends on how out of shape you are. Then work your way up to 1.5 miles to 2 miles, and then work your way up to 2.5 to 3 miles over time. This might take you a month or 2 months or 3 months. It just depends on your specific situation. So you need to consult an expert on this if you're confused about how to do it. There is a lot of information online that is very helpful. You might start there too. And if you've got a running friend that's gone through marathon training successfully, or half marathon training, or even 10K training, they might be able to help you out quite a bit based on how much to walk or run at the beginning, and then how to work into as you get better and stronger. Reason number 3 for knee pain from running and walking is your footwear, your shoes. Especially for walkers, because people that walk may not always wear the right shoes. You definitely want to have some sort of athletic shoes. A running shoe is ideal. But if you're wearing your casual shoes that don't have a whole lot of support, you might switch those out for some more athletic shoes that offer you plenty of support. Here's why it's important. You're running, you're on your feet. You're walking, you're on your feet. There's muscles in your feet and there's muscles up into the leg that just get tired as you do more. And what those athletic shoes do for you is they help support the position of your foot, which affects the position of your knee and hip and all the way into your low back. And if your muscles get way too tired because you're pushing yourself, then they won't support you the way that they're supposed to, because they're just not strong enough yet. But that shoe can give you that little boost that you can last as long as you need to. Another common mistake related to shoes is people just wear their shoes out. If your shoes are pretty old, or you've just put a lot of mileage on them, you've walked or ran on them quite a bit, then it's time to get new shoes. And there's all kinds of debates about every 6 months switch out your shoes, or every 12 months, or even if you didn't use them for 6 months, I've heard that the materials kind of wear out. There's all kinds of debate. What I would go by for you specifically is what feels best for you. I can tell you from experience, I've been an avid runner myself, and I tried switching it out every 6 months, and I tried other times as well. I couldn't find something specific. I just went by the feel. I had some shoes that I used for over a year. Currently, I have some shoes that are probably 2 or 3 years old that I still use to exercise in, and they still give me good support. They give me what I need, and they're in decent shape. I don't find a reason to get new shoes at this point, me personally. But as soon as I feel like those shoes aren't supporting me, you bet I'm gonna go get some brand new shoes, and I'll be just assessing as I go on. So that's what I encourage you to do. If you're walking out there and you're thinking to yourself, oh gosh, these shoes that I'm about to put on are 5 years old. But then you might rationalize yourself and say, well, I haven't been on a running program or walking program in 5 years, so maybe they're gonna be okay. I'd say give it a shot. But if you got knee pain and you can't quite solve it, definitely go get some new shoes. It's not gonna hurt, it's only gonna help. And that might be the fix that allows you to continue your walking routine or your running routine without having to go visit a doctor or get medications or injections or anything like that. Running shoes is always a good, easy fix for you. Reason number 4, old, unaddressed injuries. Many people had knee problems back when they were in high school, when they played sports, when they played volleyball or football, or they were running before. They may have suffered injuries back in the day, but they never really fully got them addressed. They just kind of laid off of them. And then now that they're picking up a walking routine or a running routine, they're kind of coming back. They were never fully addressed. Typically what we find in physical therapy is that there's some muscle imbalance or some improper joint movement that is kind of hard to feel or find out, or it doesn't really come on unless you stress the joint, like when you go on a walking program or running. But in normal everyday activities, it just wasn't enough to bother you. Those old unaddressed injuries now get magnified for you, especially if you're going to be more intense with your walking or running routine. So what I would strongly urge you to do is talk to an expert about this, because if you can address that old injury at the beginning of your new walking or running routine, it's going to go a lot smoother for you than if you keep running through it or walking through it and it festers into an arthritis problem or some tear in some tissue that isn't ready to take what you're going to put it through. I strongly encourage you to talk to some expert like myself about this knee problem, so that it's not going to stop you from reaching your goals, from being able to run as much as you want or walk as much as you want. If you're unable to get to an expert, there's nobody in your area, or you just want to stay at home, make sure that you're safe at home, then I strongly urge you to consider checking out our 28-day Knee Health and Wellness Boost program. What this is, it's a 28-day structured program to show you how to get stronger in your knees, stronger in your hips, even your feet. It's a structured program to make sure to boost the health of your knees and make sure that you know how to address your knee strength moving forward, how to maintain it so that you're not having recurring knee problems. Check out more about that program by visiting the link in the description here.
Hey, thanks so much for listening to our podcast. I hope that you learned a lot about all these reasons for knee pain from walking and running. If you have more questions, or you just have some specific questions about your specific problem, if you're dealing with a knee pain problem, you can reach out to us. Our phone number is 915-503-1314. Of course, if you're in the El Paso area, we can help you out directly. Now, if you are looking to find us online, you can find us at EP Manual PT. That's EPMANUALPT.com. And you could see our website there, find all our free resources right on the homepage. You can go into our blog and find all kinds of more tips and helpful advice for knee problems. I hope that this podcast was helpful for you, and we'll talk again soon. Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.